Hi friends, I'm Dr. Harmeet Singh Arora from New Delhi. I'm a senior pediatric cardiologist working in a government sector. Yeah, you see, heart has got four valves, and these valves, any of these valves may be affected at birth. The defects which are present since birth can be there in any of the valves. However, in newborn babies, when they are born, they are usually have a problem of the valve called as aortic valve or the pulmonary valve, and rarely the other valves like mitral valve and tricuspid valve. The aortic valve and pulmonary valve both are amenable in the initial stages of life by treatment through balloon dilatation. That means through angiography, we put a balloon and open them. However, in the subsequent phases, in the subsequent stages of life, these valves may not be amenable to this kind of treatment. And we have certain subset of blue babies are called as congenital cyanotic heart diseases who have an associated component of valve being affected along with that other defect in the heart. So these children are treated through open heart surgery. However, after open heart surgery also, after few years after the surgery, the valve may get affected, or it may, or whatever the conduit is put or what extra thing is put, it may get calcified and again become narrow. So for such situations where after surgery the valve gets affected or there is calcium deposition leading to narrowing of the valves, in such situations we have both the options available. Either the child goes for a resurgery, which is a very cumbersome, very hectic, very difficult procedure and painful also. And the other option is without surgery, you through angiography you put another valve. So valve can be put without a surgery also, both in the pulmonary position as well as the aortic position. So if you see especially the last 1 decade, it has seen a revolutionary change in the treatment modality. The availability of various gadgets, various hardwares which are available for treating such valve conditions, it's tremendous. And our country has progressed to a level where we are at par with any of the advanced such techniques in elsewhere in the world. So in the last couple of decades, if you ask me, the non-surgical methods of valve treatment of valve problems has come up to a bigger stage, both in the aortic valve, the pulmonary valve, even the mitral valve can be replaced. Tricuspid valve now can be replaced without surgery, which is a big, huge step in the overall development of this section of the cardiology, pediatric cardiology or adult cardiology in the country. If you talk about the surgical, this thing, if a child undergoes a surgery, it's a open heart bypass surgery. A child takes time to recover. He or she is in the ICU for a long time, and then the child gets discharged. Then there is a rest period of 6 months to 1 year, and after that child can resume the normal activities. Vis-a-vis, if the child undergoes same procedure through non-surgical techniques, transcatheter closure or percutaneous closure, the recovery is faster. The child comes back to normal life within a couple of weeks or maximum a month or so, and he can resume his activities accordingly.